I was diagnosed with severe normal tension glaucoma in July of 2020. I initially went in for a sty, and when the OD looked at my nerve, she said, "I don't like the look of your nerve." And I said, "Well, I don't know if you know I'm here, but I'm actually here about a sty." And she said, "Well, I'm more concerned about your nerve." So we did a few more tests. And when my visual field and my OCT came back, she said, "I need you to see a glaucoma specialist as soon as possible." 2 days later, I was at the office of the glaucoma specialist where she confirmed that I did in fact have glaucoma. At that point, my eye pressures were 13 and 14. So I had super low pressure to begin with and a significant amount of damage. So with normal tension glaucoma, it's often not found until it's in a more severe stage due to the fact that your pressures are normal. So there's not really that red flag that usually comes up. I have had, and my background has been in medical sales my entire career. So after I was diagnosed, I wanted to learn more about glaucoma, first of all. And then I wanted to try and help people that had this, because losing your vision and your sight is such a big fear for people. And it is for me as well. So I started researching, and I found a job in glaucoma sales, glaucoma device sales. So I actually worked in glaucoma device sales for a couple of years. And during that, I reached out to the Glaucoma Foundation, and they asked me to speak for them on a couple of occasions. So it just kind of organically has developed into me doing some speaking and doing patient advocacy and having this as a career. So it's just kind of all developed, and it has been, it's so close to my heart that it's something that is, that I'm super passionate about. Losing vision, losing sight is very scary. First off, I went through a period of time where, I was super depressed for a couple weeks because it was just so much to handle, knowing at first when I was diagnosed, I didn't know how severe my vision loss was. And then over time, learning more, I realized, wow, my visual field is worse than a lot of the people that are sitting in this doctor's office with me. And that was super scary because I was younger than most of the people in the office. And so I have more years to try to save my sight. For people like me, it's a little harder because my pressure's low to begin with, but the treatment for normal tension is currently the same as it is for high pressure glaucoma, which is just to lower the pressure even more. So the normal tension glaucoma study was done, and it showed that if the pressure was lowered by at least 30%, that there were some protective properties there to keep your visual field protected. So that's kind of the goal, is the 30%. With that said, the treatment options are drops, which, most of the drops have preservatives, which irritate the eyes. So the best thing for patients is to find a drop that works for them with side effects they can handle, because they all have side effects. You can do a procedure called SLT, which can lower the pressure. There's different MIGS devices in procedures and surgeries that can lower pressure. And then there's more traditional, more invasive surgeries once you're more severe and you really need the pressure to get super low. So there's lots of options for glaucoma patients, and we need even more because everybody responds differently. So it's important to have lots of options. I am absolutely overjoyed with the announcement that came out yesterday, saying that these LCDs that Medicare had released, putting restrictions on MIGS surgeries, are withdrawn. So it's been amazing. I've been fighting for the last 2 months for this. So I have started a petition. I've reached out to thousands of patients, hundreds of doctors, many organizations to try to get some groundswell of support for this issue. And, yesterday that all came to fruition, and it ended up paying off, which I think is amazing. I talked to a couple of the companies, and they were given a 1% to 3% chance that this was going to turn around. So we really were fighting an uphill battle. And I was just in it until we were done, because I was going to keep fighting until these were withdrawn. Basically, the LCDs limited the MIGS surgeries that doctors could perform. Medicare just wasn't going to cover them. So, if you could pay out of pocket, but that's not a lot of people that are on Medicare. So the restrictions would have curtailed the choices for the doctors. They also were going to have mild to moderate patients have to use more invasive procedures instead of these minimally invasive glaucoma surgeries that, MIGS are. And that was going to cause a lot more upkeep, a lot more surgical complications are involved with the more invasive procedures. So it's more visits to the doctors, more chances that problems can occur. These MIGS procedures and surgeries are incredible in that they're done very small. Many of them are titratable, so you can do as much or as little as you'd like. And it gives the doctor a lot of options. And this is something that, if taken away, then it would have really, really changed how glaucoma was treated. These MIGS surgeries are newer surgeries in the last 10 to 15 years. And they basically were going to throw everything back in time before the MIGS surgeries were available and say, go back to what you did, 15 years ago, which if you look at any health field, that would be considered insane to go back to what you used to do. When you know better, you want to do a better surgery and you want to do better for your patients. So to say that I'm overjoyed with the withdrawal of these LCDs is really an understatement, because it's been such a hard fight and so many patients, doctors, and organizations and companies have fought for this. And to that we won is just amazing. I looked for support wherever I could get it. So I started the petition to oppose the LCDs, and I went to glaucoma support groups to try to get people to sign the petition. I tried to explain the issue as clearly as possible. I reached out to doctors that I knew were instrumental in the glaucoma community, that were voices that people would listen to. I reached out to different organizations that I hoped would help me. I reached out to media outlets to try to spread the word about this issue, because a lot of patients just didn't understand it. And they thought, well, Medicare's just my secondary is going to cover it. And I was trying to explain, no, it won't. This is just going to put a blanket on top of everything and not let anything be covered. And, soon after that, commercial insurance follows. So I knew this was such a pivotal moment in time that something had to be done as soon as possible to try to, have the result that we ended up getting, which was the withdrawal of the LCDs. But I looked for support wherever I could get it. I reached out to family, friends. If you care about my eyesight, if you know anyone with glaucoma, please support us. Please support this petition. And it ended up working. And I think the power of the patient is huge, because I think if just doctors and companies were out there fighting, I don't think it would have had the same effect. I think that the patient voice means so much. And, if you look on the petition, there are patients and doctors that have written stories of how glaucoma has affected them, how the MIGS surgeries have helped them. And I want people to go there and just to read the stories, because it's so heartfelt. The messages are heartfelt, and everyone's so passionate about this, and we all just want to be able to save our sight. I think the most important thing patients can do is ask questions. If you don't understand what the doctor's telling you, ask question. If you want a second opinion, go get a second opinion. It doesn't mean that you don't trust your original doctor. It's just good to get different points of view. If you go to 5 different glaucoma specialists, you might get 5 different opinions on what to do with your eyes. It's ultimately the patient's decision on their treatment. So for them to get a second or third opinion, whatever they need in order to find peace of mind, I think that that's okay. And they need to ask questions. They need to, if they're not clear on what's happening, then it's best to bring a family member or a good friend to the appointment with you to listen, so you have a second set of ears, because you might have heard something differently than your friend heard it or your family member heard it. So it's important to have a second person there, and questions. If you don't have enough time in the appointment, then make another appointment. The doctor's schedules are very, very tight. They see so many glaucoma patients a day. And so it's important to advocate for yourself and to make sure that you understand what's happening, what procedures you're offered, what your treatment options are, and to second guess and question everything. I think that glaucoma is, they call it the silent thief of sight. And I just don't want people to be silent anymore. When we lose vision, I always thought it was, you either had sight or you were blind. But that's not how you lose your sight. You lose your sight in pieces. So there's pieces that are missing. So in glaucoma, those of us who have had loss of sight, we have pieces missing. And I think the most important thing is to focus on the pieces that are there, to focus on the positives, to focus on the sight that we have. Because if you focus on the pieces that are missing, you're gonna go down a road that's gonna be a little frustrating and depressing. So let's focus on the pieces that are there. Let's focus on the sight we have today, and let's move forward together and fight for our sight.